we started this with a very good mission statement. We wanted, apart from what you see, the vision, the caring mission, global vision and all, we wanted to do 5 things actually. There was a very clear mission. The first one was to have international level healthcare delivered at the doorsteps of the people of Malabar at affordable cost. This was the first part of the mission. The second part of that was to provide a platform for medical professionals outside the country and outside Kerala to relocate to Kerala and serve the people here. Because at that time, most of the advanced treatment was happening in other states like Karnataka or Tamil Nadu or even far away or out of India. So we wanted this to be provided in Kerala, and we thought that people, Keralites, doctors, nurses, paramedical staff should come back and do that. So that was another important mission which we had. We had another mission that we wanted to provide an environment for medical education and research which will improve the standards of caring as well as attract people into those areas. That was the third thing. And the fourth thing was we wanted to provide subsidized or free healthcare to the poorer sections of the society who are not able to afford the treatment available at such an institution, having high cost of capex and naturally high charges in the tariff. And the fifth one and final one was that we wanted to provide a decent return on investment to the people who invested this money. These were the 5 visions or missions under which we started MIMS Hospital. So investing 60 crores and achieving this at that time was thought to be something very, very difficult to achieve. But we thought that we should do. And I am glad to say that within a short period, we achieved many of these. And the only thing which was not achieved was paying something to the investors, which last 4 years we are able to do, even though not to a very great extent. To some extent we are able to give them a dividend. And now the situation of MIMS is improving, and we hope that we will be able to pay a much more handsome dividend in future years. But MIMS completely changed the healthcare scenario of Malabar, and we are proud, happy and feel accomplished that this has been able to provide quality healthcare at affordable cost to many people in Malabar and save thousands of lives, apart from helping people in the poorer section and allowing a lot of doctors and nurses to come back, and also now with the more than 1,000 students there doing that duty of medical education. So what I am trying to tell you is that there was a vision behind it, there was a mission behind it, and there were a team of people behind it who could achieve that. Now, then we wrote the Vision 2015 for our group, DM Healthcare, about 4 years back, 2007 or 2008. This was to achieve something by the age of 2015, where we wanted, at that time we had just maybe 40 establishments, and we wanted to establish by 2015 300 establishments, healthcare provider units in Gulf countries and India together. This was thought to be again something which was unattainable at that time. The team which sat together, analyzed the Gulf countries and India and the potential and what we should do in the next 8 or 9 years, thought that we have to have a clear vision what we are going to achieve in the 7 to 8 years. And we wrote a Vision 2015. And happy to tell you that midway through that, 2011, we are actually achieved whatever we wanted to achieve during this period. And we are on our way to achieve the 300 numbers, of which about maybe 20 or 25 will be hospitals, Gulf as well as here. Another maybe 75 or so will be clinics, and the rest will be pharmacies. So this is something which actually again tells you the importance of visualizing things and having a clear goal, what you want to achieve. If you are focused on that, and if you have people who can buy into that, there is definitely the chance to achieve that. And you should have the team also to do that. You should have people who can be with you, who can buy into that and take it forward. It's very important at this point of time, as a learning, I should tell you that the greatest thing is to build teams around you. Nobody can be a person, a self-made man, as sometimes we call. I am sure that it is only by the hard work of many others, and together only we can achieve things. All of us know the importance of building teams. And that is actually the most important differentiator between a very successful person and a mediocre person or a normal businessman. If you are able to have a team which can do things according to your plans, or they together, not according to your plans, our plans, or the plan which we put together with those people who are with you, that's very, very important if you have to expand, if you want to achieve beyond what is. The leadership is actually, true leaders are ordinary people who do things with the help of people and believe that 1 and 1 is not 2, but it could be 3 or 4 or 5, and believe in the power of synergy and the strength that you could get from that. I have been successful in that, and that has actually happened because of my experience in my college days, as I told you, both Farouk College as well as Medical College, where I had the good fortune to work in associations, unions, interact with people, and that actually was a great learning experience where you could have teams being built around you or along with you, where you can take them forward and they believe in you and walk with you. It's a very, very important. And you should have the capability to delegate, which again is an extremely important thing for anybody in business. If you want to be successful and if you want things to be done in different places, apart from the single unit which you are sitting or maybe few around you, you have to have the confidence level that others can do things better than you actually. That's very important. You should not think that you are the only person who can do things. You should have belief in others. You should trust them. You should entrust them. And you should always support them to achieve what they are intended to achieve. I have been fortunate in that. I usually find it very easy to delegate. We have now operations in 5 countries and significant operations other than in the central office which we sit in Dubai. And we entrust people, we tell them, we of course interact with them, and when they require support we provide that. And for example, the MIMS hospital here, it's completely managed by a team from here who are quite capable and doing it extremely well, much more than what we could have done if we have directly got it involved. So what I wanted to tell is that there has to be a requirement for building teams, and also there is a requirement for delegation if you want to go forward. Now, vision again can take you to levels, like for example, now we are visualizing something what was mentioned here, like the Medcity at Kochi. Medcity at Kochi is something beyond what you are now experiencing or seeing in India. I have had the experience to set up hospitals, clinic, pharmacies, and I wanted something which was not there or is not there in the country, which is comparable to anything what is seen internationally. So I had visited a lot of countries, lot of institutions, collected a lot of information, and thought that as I stop or I go out as an active participant in the management of things, there has to be something which tells that this is an iconic structure or organization in the establishment of which there was a person in which my name also comes out. There will be a team, of course. I will be very happy to be a part of that, and maybe leaving behind a legacy is an urge in human beings. And if it could be achieved by establishing something which is going to be useful to generations, that is a great feeling that you will get. So MedCity is going to be something, when it is established, going to be entirely different from what you are seeing in healthcare delivery now, because it's going to benchmark against the best in the world. And our hope is that it will be, in the next 15 to 20 years, will become a destination for health travel from around the world and benchmark against the best 10 institutions in the world. So that is a vision. So again, there is something which you want to achieve. As somebody said, you aim at the moon, you may at least hit the lamppost. And we know that it is not lamppost. You go much above that. At least you go into the outer space, if not the moon. So this again requires people around you, large amount of resources, and the most importantly is the human resource which is required. And bringing those people together and again leading them or giving them the support is very important if you want to achieve such things which are not accomplished so far in a setting of our country. I don't pride, but I feel actually many times when somebody gives me an award or somebody, I got a lot of opportunities. God has been so kind to me to receive awards and all. So I have been blessed with that. And I always feel that this is actually the hard work of the people who have done that, and it is not me actually. I happen to stand there and receive it. It is actually like the general or colonel, as I always tell, who gets all the credit for winning the war, but it has been won by the soldiers who have fought in the field. So I always consider people who are daily fighting wars outside the country as well as here. We have nearly 4,000 people outside, and again with the associated institutions like MIMS, another maybe 2,000 to 3,000 here, who are every day, day in, day out, fighting wars on a vision which you have created, on something which you have told is going to be great, and they are the people actually toiling. Those people who are toiling are actually the heroes, and you have the opportunity to stand there and achieve, receive it on their behalf. I am humbled to look at that. I am being called chairman by many. I am the chairman of a group, and just to break the very serious note of things, I just want to crack a joke with you which I have shared with many. I heard a story. What is chairman? Chairman, one of my friends said a story where somebody went to buy a donkey. So the farmer showed 3 donkeys, and he asked, what is the cost of the first donkey? The farmer said, the first donkey will cost you $1,000. This was in US. So he asked, what does this donkey do? Then the farmer said that this donkey carries a normal weight and all. So it is the normal type which does all the routine work, and nothing special to sing about it. Now he asked, what is that second donkey? What does it cost? It didn't look much different, little stouter. So he asked, what is this donkey cost? So the farmer said that this donkey cost you $5,000. He said that why should this cost $5,000? Why is that this donkey very costly? Then the farmer said that this donkey has got some special knacks. It's